Hey, great seeing you again. Okay, this is Dr. Michael Valentine.
Hi, this is Dr. Leonard Valentine.
And what we're going to do and discuss today is we're going to discuss some auto injury facts. You know, we see, of course, being in practice for over 30 years, we're seeing more and more patients, of course, that are in these auto accidents. And a lot of people are led to believe that auto injuries are like a no big deal. But we've actually become part of a group, a network of doctors and research across the country. There's about 1,000 doctors involved in this group, and it's critical to understand the auto injuries and the devastating lifelong effects as a result of these injuries. So there's a couple facts that we want you to know, and we had a great research paper as well, but we'll get into that the next time because we're trying to do these every week, once a week. And if you got any input that you want to ask a question or something like that, then please go ahead and do that. We'll try to monitor that with Rose at the front desk. So let's talk. Okay?
Yeah, sounds good. Huh? Sounds great. Yeah, so sometimes what I find is people think that, you know what, it's not a big deal, the accident, and so that I don't really need to have it checked.
Oh, wow. Yeah.
You know, gosh, there's a lot to say about that. But anyway, we can, because we've been around long enough, we can do a thorough enough evaluation to find out indeed if there is an injury and it's something that you need to have treatment for. So don't be your own doctor on this situation. It's best to give us a shot to do a real thorough exam, get a good consultation from you, because truthfully, yeah, if you're young and you've never ever been injured and the accident doesn't have much damage to the car, well, you may not be hurt. But, you know, if you have
identify that them for themselves. Yeah. And this is a good point you bring up because I'm just going to give you an example. There was a patient in the other day, and the patient, you know, machismo, male, of course, and not thinking anything's wrong. And no big deal, he's going to get over it. And when I started the examination, and we're probing, we're prodding those areas, you know, and as soon as this guy's he's in a lot of pain. Well, of course, that is not normal to elicit that type of pain. So Dr. Leonard's exactly right. You think you're not injured, well, don't make that decision yourself. We'll get an evaluation by someone that's super qualified. And we'll be able to pick. Yeah, us, of course.
Exactly. Over 30 years,
let's go ahead and evaluate the situation for you because it's better to always identify if there's some injuries because your body starts to lay down scar tissue.
Within 24 hours.
Within 24 hours if it's a car accident.
So, yeah, you got to take immediate,
action is really critical.
Yeah, absolutely.
So a lot of times people go to the urgent care. That's a good idea. If you're involved in an accident, go to the urgent care. Get evaluated. But then get in to see us. And that's what our prime focus is this year, is meeting with the GPs and urgent care centers and other specialties like orthopedic surgeons and neurosurgeons so that we can provide the best kind of network of doctors should anyone need to have anything beyond our chiropractic care.
You know, what we experience so often and too often is somebody, well, a few people, a number of them have had some chiropractic care, but the chiropractor didn't make a big deal out of it. He thought that they weren't that injured, so didn't give them the necessary care that they needed, or the patient didn't do anything, or the person didn't do anything, and then 2 or 3 years later, they're experiencing all these pains, and they're wondering, where in the heck is this coming from? Yeah. And then when we do good history...
I'm getting older. That's what people rationalize. It's normal getting older. But then another critical thing is to have special motion studies that we do. So you've got to have motion studies because the motion studies as far as x-rays are going to determine if there is ligamentous damage or what we call ligamentous laxity. What that means is that ligaments are like support the cement between the bricks. So ligaments are holding the bones together. If there's ligamentous laxity, that scenario is a lifelong scenario of instability, of arthritis, of degeneration, of disc disease, and everything else. And the good news is that can be controlled with chiropractic.
And now we can also talk about that actually within the AMA, that laxity, the stability that...
Instability,
Well, disability rating.
Oh, yeah.
From
there you go. Yeah, instability and disability.
Yeah, so that's something that, because we do that for you, it can take a case that the insurance company says this isn't really a big deal to, now that we've done that particular study, now it makes a lot more value to that particular case.
Well, and that's a good point you bring up, because the AMA guidelines, I think it's permanent impairment, and it's number 4, 5th edition. But anyways, that a ligament damage, and again, that'll be seen on special X-rays or MRIs that we perform, because we make sure that we specially, order those particular views. But that equates to a 25 whole person impairment. So, for example, if you lost your leg, one of your legs, right? That's 25%.
Yeah.
You lost one of your legs, that's 25%. But that's not as big of a rating as someone that has this ligamentous damage either in the neck or in the low back region. That is a 25% whole person permanent impairment. And that's huge. That is really huge.
Yes, and what we will have to talk about, not today necessarily, but something we have to talk about, and I just did this myself. You need to really bring your policy in and have us check your policy, because just recently it was brought up to me that my policy wasn't really protecting me like it should be. Wow. So if anything we could do as a service to not only our patients, but our patients' friends, family, anybody, even ideally before they have the accident, we review this with them, so that they're well protected.
And Doc, you bring up a great point, because a lot of times you're relying on your agent. And the agents don't really understand the whole implication from the medical legal standpoint. So when he talks about protection, most policies have a liability of like $15.30, which is a joke. It hasn't changed since like the 60s, and here it's 2017, and it's ridiculous because there's people that are allowed to have that minimum policy.
And I understand they have been talking for 10 to 20 years to with inflation to have tripled that as being the minimum, but they have not. For some, it's probably politics.
It is politics, always politics. So understand that the big thing that we're hoping is that we have our passion. We have our passion for helping you as our patients. We have a passion for helping other people, and of course, when we get together, it's all about education. It's all about helping others so that we can provide the best quality service and do a great job to keep you well, because it's all about quality of life. And now that we're going through the aging process, we understand.
We have experience, more experience.
We have too much experience, but it is about the quality, and it's about keeping active and everything else. So hopefully you like these live, Facebook Live events that we're putting on. We're going to, next week, I think what we'll do is we'll cover that policy. We'll try to break down the policy and maybe have a portion of this where we have a policy up, and we'll analyze that, because of the fact, again, most people they have policies that are really not protective at all. But for a couple dollars more a month, because people think, well, you get more insurance, it's really going to be expensive.
So for me, recently, to protect myself better, because people have such minimal, so that I am protected in case they only have minimal. It was $40 for 3 cars every 6 months.
Oh,
but still,
$40 total?
Yeah.
Oh my gosh,
yeah,
that's
to like triple my underinsured and uninsured. Yeah.
Wow, that's incredible.
So,
that's so cheap.
And if you can't wait and want to find out right away, what you have in your policy, come by tomorrow. I mean, tomorrow we're
drop it off. You can email it, askdrvalentine@gmail.com.
That's one way we could do it. Call us. Come by. We'd just be happy to. Go over
and
that.
if you have any other questions, about what's going on as far as your health-wise, we're big time into nutrition, as well as chiropractic. We believe that the two have to be combined together, because 20 years ago we saw that people healed so much better back then than they do today. So we have to look at things from a holistic standpoint. And that's the nice thing about chiropractic, is that we're kind of the founders of the whole holistic movement.
Isn't that the truth? Because we've been using standard process since 90 years has it been around, and only chiropractors use that particular product.
And some dentists were using it at the time. It's mostly chiropractic.
So people think nutrition is new. It's not new. No. Chiropractors have been doing it for a heck of a long time. Because really, they're very open. They're not tied down to any particular type of health care, and that they're open to many different types, whatever would help you.
So spread the word. We plan on doing these live events every Wednesday. We're going to get into a pattern. You probably saw maybe some other live events that we had on. That was Marianne and I joined together, all about the nutritional ketosis, and we'll talk about that on another time too, because I've been doing this for several months now, and it's been fabulous. I love it. I'm excited about it, and we're excited to share that with you and your friends and family. So if you really like these live events, I recommend that you like them and that you share them so that your friends and family
Appreciate that. Yes, that'd be
can
great.
go ahead and do that. So we want to just thank you for this opportunity.
Yes, it was great being with you guys.
Yes, and have a great day, and we look forward to seeing you next week.